Hello everyone, in this video I want to first go over some mnemonics that might help you with remembering some features of diseases that are involved in heme synthesis pathway. Now I want to start off with acute intermittent porphyria. You can remember the features of acute intermittent porphyria with the 5 Ps. So we're going to see abdominal pain, polyneuropathy, port wine colored urine, psychological disturbances, and this disease can be precipitated by drugs, mainly CYP450 inducers. Now, the enzyme deficiency that is going to occur in acute intermittent porphyria is going to be porphobilinogen deaminase. The way you can remember that this is going to be caused by a deaminase deficiency is that you can use the A in deaminase and you can associate it with the A in acute to help you remember that acute intermittent porphyria is going to be caused by a porphobilinogen deaminase deficiency. Now let's move on to porphyria cutanea tarda. This disease can be abbreviated as PCT, and you can use PCT to help you remember some of the features of this disease. So P for photosensitivity, it is going to be associated with hepatitis C, and we can also see a T-colored urine. Now, this disease can cause a blistering rash. And a quick way that you can remember that a blistering rash is associated with porphyria cutanea tarda is by using this mnemonic, blister. So TAR to help you remember that porphyria cutanea tarda is going to be associated with a blister. So make sure to associate TAR in blister with tarda. Now, the enzyme deficiency that is going to cause porphyria cutanea tarda is going to be uroporphyrinogen decarboxylase. So use the C in decarboxylase and associate it with the C in cutanea. So porphyria cutanea tarda is going to be caused by a uroporphyrinogen decarboxylase deficiency. Now let's move on to sideroblastic anemia. Sideroblastic anemia is going to be caused by a synthase deficiency. How can we remember this? Well, the S in synthase can be used to remember that this enzyme deficiency is going to be associated with sideroblastic anemia. So there's going to be two S's. And this is also going to be the rate limiting step in heme synthesis pathway. Now let's move on to lead poisoning. There's going to be two enzymes that are going to be inhibited by lead. One is going to be ALA dehydrogenase. This is going to be the enzyme that is going to be outside the mitochondria that lead inhibits. How can you remember that ALA dehydrogenase is inhibited by lead? Well, use LAD in ALA dehydrogenase to spell out lead. How can you remember that dehydrogenase is the enzyme that is going to be found outside the mitochondria? Well, use the DE in the word outside to help you remember that dehydrogenase is going to be the enzyme that lead inhibits outside the mitochondria. And the enzyme that lead inhibits inside the mitochondria is going to be ferroketolase. Now, using these mnemonics, let's solve a UL question. A 24-year-old man presents with recurrent blistering on the back of his hands and forearms for the past several years. The patient usually develops small itchy spots, but lately has had large blisters that heal with hyperpigmentation after rupturing. He drinks 2 to 3 cans of beer daily. Physical exam shows vesicles and erosions on the dorsum of both hands. Which of the following enzymes is most likely deficient in this patient? So there is a enzyme deficiency that causes this patient to have a blistering rash. And we said that blistering rash is associated with porphyria cutanea tarda. So blister to help you remember tarda. Now, what enzyme is associated with porphyria cutanea tarda? Well, we said that you can use the C in cutanea to help you remember that there's going to be a uroporphyrin decarboxylase deficiency. So the two C's. So the answer is going to be answer choice E, which is uroporphyrin decarboxylase.